Hello, I'm Dr. Tanya Ghosh. I'm an ophthalmologist, which is an eye surgeon, and I specialize in treating diseases of the eye that affect the retina. I'm a retina specialist. I would like to spend this time talking about the eye disease called macular degeneration. You may have heard this term before, as it is relatively common. It's the number one cause of decreased vision in our adult population over the age of 65. What is macular degeneration, you ask? The back of the eye is coated by a tissue called the retina. The center of the retina is called the macula. The macula is very important to us humans because the macula is what gives us our ability to see fine details. For example, you must have fine vision to distinguish between the letters such as a P and a B, to know and also to recognize each different number. Animals such as deer have excellent peripheral or side vision. However, we humans hold our central vision in high regard. In macular degeneration, the macula alone appears to progressively age and degenerate at a rate much faster than the rest of the eye or even the rest of the body. This causes our central vision to be compromised. This disease does not lead to complete black blindness, and it is only really affects the macular area. Why does this happen? Researchers have found genetic causes for this degenerative disease, and it's linked to dietary habits. This is why we ask you about a family history of poor vision. Did your elders have a hard time with their vision as they aged? That's a very interesting question for me. Back to what is macular degeneration. Some diagnostic characteristics of macular degeneration involve spots of aging in the macular area. These spots are called drusen, and they are areas of degenerated, sick macular tissue. If there are just a few aging spots or drusen, we just call them drusen and say drusen are present. When there are enough drusen either in number, size, or location that may cause some change in the quality of sharp visual acuity, we then call it macular degeneration. So I often ask, with your reading glasses on, how is your vision for reading fine print? If everything is fine in your near vision, I doubt I'll give you the diagnosis of macular degeneration. And I haven't even looked at your retina yet. Upon looking at your macula, I'm looking for drusen. They tend not to be subtle. If I do see drusen that has caused some death of macular tissue, and if there is any compromise of your central vision, I will likely diagnose you with macular degeneration. Let's talk about the different types of macular degeneration. If I do see drusen that has caused some death of macular tissue, and if there's any compromise of your central vision, I will likely diagnose you with dry macular degeneration. However, if I see drusen with loss of healthy macular tissue, and I see evidence of a blood vessel in the area wanting to come and explode, leading to blood and eventual macular scarring, I will call it wet macular degeneration. These bad blood vessels are called choroidal neovascularization, or new blood vessels, and they can cause a rapid loss of central vision, so we're on high alert of all these vessels. The vast majority of patients have the dry macular degeneration, with about 10 to 15% having the additional occurrence of the neovascularization. However, dry macular degeneration can cause frustrating and disturbed central vision, and it is a progressively worsening disease. But the progression of loss of the vision can be relatively slow over the years. Wet macular degeneration, on the other hand, can cause visual distortion as the neovascularization starts underneath the retina. These blood vessels can then burst in the macular area and cause permanent central scarring. This wet macular degeneration is much less common than the dry macular degeneration, but the loss of central vision is much accelerated, and the amount of central vision loss can be even greater. What type of macular degeneration do I have? A comprehensive eye exam by an eye professional, such as an ophthalmologist or optometrist, is the way to make the definitive diagnosis. The reason you must have an eye exam by a qualified eye doctor is because there are other eye conditions which can affect the macular area too, causing similar symptoms but being caused by something other than macular degeneration. Sometimes the other eye professionals can be confounded and will then request a consultation with a retinal specialist for further investigation and clarification to make the correct diagnosis. As trained and experienced retina specialists, we have tools to look at the retina at a greater degree than the instruments in our little office cubicle. The first is the fluorescein angiogram. This test allows us to get a much more detailed exam of the retina than just what we can see with our eyes in the exam room. We are so fortunate to have this high-level technology right here on the premises. We start by injecting the orange fluorescein dye into your arm, which then immediately circulates throughout the body and quickly gets to your eyes. A skilled photographer immediately starts taking filtered digital photographs as the dye passes through your retina. This lights up the retina, giving much more detail than just the clinical exam. The session at the digital camera is about 20 minutes long. Are there any risks? Thankfully, just a few. The fluorescein dye will circulate through the body and you will urinate a bright orange yellow for the next 2 days as the body gets rid of the dye. There are no known interactions with any medications, and there are no known risks with any health conditions, including kidney disease. In rare cases, a person can have some nausea or even some minor vomiting during the procedure. It tends to last about 3 minutes. On occasion, one can have an allergic reaction with some itching and hives. There have been reports in the literature of people having shortness of breath, chest pain, fainting, and even death, but these are all very rare. We here are very well trained to deal with any of these rare situations, but you will pee bright yellow for 2 days. The fluorescein angiogram gives invaluable information by letting us study the retina essentially cell by cell. In macular degeneration, we are looking for the extent of tissue loss in the macular area, and we are especially looking for those insidious central choroidal neovascularization blood vessels, which can be tricky to be seen in the clinical exam because they're underneath the retina, but are so important to find. The second common test we do is the OCT, Macular Optical Coherence Tomography. We also have this on the premises. This is a picture that is looking at a cross-section of the macular area, searching for areas of cell changes, especially drusen, and looking for the presence of neovascularization. What do I do if I have macular degeneration? There is a strong correlation between macular degeneration and dietary habits. Yes, this is a genetic disease, but the severity is affected by the quality of food intake. It has been long published that those on a Mediterranean diet have a more favorable outcome over the years. I thus urge my patients to really lean into a very whole food, plant-based diet with the limiting of animal products, including eggs, and processed food. You may even want to discuss this with your children as a potential way to stave off this disease. Smoking also has a strong correlation with macular degeneration, and I highly recommend quitting and avoiding secondhand smoke to protect your vision. There is a question on sunglasses. In the olden days, meaning prior to the early 2000s, before we discovered the genes, doctors surmised that macular degeneration was caused by excessive sun exposure and rigorously instructed patients to wear sunglasses. That has been called into question, especially in a world where we are mostly indoors and far from the equator. Even regular eyeglasses cut out a lot of UV light to the eye, as does having a cataract in the eye. Wearing sunglasses or a visor outdoors on a sunny day may protect against UV light, but I no longer force these on patients. Many elderly persons may already have compromised vision, and sunglasses may further degrade the vision, putting them at risk of falling or other injuries. Let's talk about AREDS2 vitamins. When you have moderate to severe macular degeneration, we recommend AREDS2 vitamins. You can find these over the counter at your local drugstore or Costco. The AREDS2 vitamins formula was found in a national study by the National Eye Institute of the NIH to slow down the progression of macular degeneration in some people. However, this combination of vitamins is not a catch-all solution. The study actually looked as it was found it didn't demonstrate any preventative effect for those with early macular degeneration, nor did it show significant benefits in individuals who take it purely as a preventative measure. In some people, the AREDS2 vitamins can cause some gastrointestinal distress. So in those individuals, I recommend reducing the dose from 2 pills a day to once a day, or even every other day. If that is intolerable, I recommend getting your vitamins directly from Mother Nature by eating lots of fruits and vegetables. What is in these AREDS2 vitamins? Vitamin C, vitamin E, zinc, copper, lutein, and zeaxanthin. In the study, there was no harm in adding a multivitamin to your AREDS2s. Some other considerations are as follows. People with high blood pressure and high cholesterol levels don't do as well as those with better control. Exercise and good movement is also a positive factor. You can follow at home with an Amsler grid or checking any straight area like a door jamb or Venetian blind. Close one eye at a time and see if you see a new wiggle. If you do, sometimes that can be a sign of an emergence of neovascularization, so do call us within a day or so if you see something new. How is macular degeneration treated? The great news is that new therapies are emerging daily. As of now, outside of AREDS2 vitamins and diet, there really is no true consensus on treatment for the dry macular degeneration. There are some treatments out there, but they remain debatable as far as the risks and benefits. But I assure you that my retina colleagues and I are assessing all the new techniques with both hope, but a still critical eye. I don't want to miss out on a potentially beneficial treatment, but I'm really leery of snake oil treatments too. I just want a moment to emphasize that once true destruction of the retina has occurred, we don't have a way to reverse it. If your vision is severely compromised, we can always give you a referral to a low vision specialist who works with special magnifying glasses to help your reading vision. Don't hesitate to ask us about this service as we have excellent practitioners in our geographic area. Back to treatments for wet macular degeneration. We now have decades of experience and evidence on treatments for the wet macular degeneration. These are injections into the eyes. There are signals in the eyes that tell the eye to grow new blood vessels, the neovascularization. The new treatments are called biologics, or as we call them, anti-VEGF drugs that stop the message so new blood vessels no longer grow but rather shrivel up. Until the biologic drug is used up by the body and the message starts again. This is why we have to continuously give the medication, usually every month in the beginning, trying to extend the time once we have a few loading doses. We've learned that this is a lifelong treatment, and this treatment does not stop the atrophying effects of the underlying dry macular degeneration, which is going on at the same time as the neovascularization is showing up. As I mentioned, we don't have a treatment to stop the dry macular degeneration from progressing, except diet and AREDS 2. So the dry macular degeneration and wet go hand in hand. We have treatments only for the wet type. I usually start with the Genentech developed biologic called Avastin. It is FDA approved for colon cancer, but pretty much every retina doctor on the planet has either known about this drug and has used it, and the government knows that we are using it. It came out in 2005. For political reasons, it is reasonably priced relative to the newer drugs. If Avastin doesn't give me the optimal result that I'm looking for, I will suggest moving on to the other wonderful but very expensive biologics after getting approval from the insurance company. We clean the area around the eye and the actual eyeball itself with betadine after numbing it with great care. The injection with a very thin needle is about 2 or 3 seconds. You'll feel some pressure, but the pain is nowhere near what you are imagining right now. Afterward, I ask that you not get into a hot tub or swimming pool for 24 hours. Showering, exercising, airline travel, bending over, and anything else is not restricted. Are there any risks to the injection? The one risk that is of permanently blinding infection, which is thankfully extremely rare but present. There are signs such that if caught early, we can put an end to the infection. Signs of potential infection occur about 3 days after the injection. You may notice that the eye is becoming more uncomfortable and light sensitive, painful, blurred vision. The eyelid has swollen up. Please call on the phone our front desk immediately should you notice that. We are open for these types of emergencies 24 hours a day, 7 days a week. No need to go to urgent care or the emergency room. Call us directly. We will give you this as a written reminder at the time of your first injection. Sometimes the eye can be a bit irritated immediately after the injection. I recommend using artificial tears, cool compresses, oral pain medications, and the best is to take a nap should you need it. Oh my goodness, this was a lot of information. Please don't be intimidated. We'll be discussing many aspects at every visit, and I'm always ready for your questions. These are the tips to actually take home. Keep your body active. Eat lots of fruits and vegetables, beans and lentils, eating fewer animal products and processed foods. Control your high blood pressure and high cholesterol. Quit smoking and avoid secondhand smoke. Take your AREDS 2 vitamins if you're a candidate. Use your Amsler grid or look at a straight area like a tree or a door jamb, one eye at a time, looking for new distortion. Follow your eye doctor's prescribed follow-up schedule. Thanks for your time in watching this video. Your eye doctor will be in to meet you shortly.